I need you to listen to me with absolute clarity, because what I'm about to tell you is not a theory, not an exaggeration, and certainly not fear-mongering. It is a reality I have witnessed over and over again in more than 3 decades working in emergency medicine. Most people over 60 do not survive their first heart attack when they are alone. Not because their bodies are weak, not because they lacked willpower, and not because their time had come, but because in that single critical moment, the moment that determines whether you live or die, they simply did not know what to do. They hesitated. They doubted their symptoms. They tried to wait it out. They told themselves it was indigestion, anxiety, fatigue, or something that would pass. And while they tried to rationalize the sensation in their chest, the real clock, the biological clock counting down the viability of their heart muscle, continued ticking mercilessly. I have seen this tragedy unfold so many times that I can almost predict it before it happens. The symptoms begin quietly, a strange pressure across the chest, a wave of nausea, a sudden breaking of cold sweat, a crushing fatigue that feels as if oxygen has been drained from the air. Most people over 60 will sit down, hoping it goes away. They wait 5 minutes. Then 10. Then 20. And by the time they realize something is truly wrong, the golden window, the precious early minutes in which immediate action can preserve heart muscle and save life, has already closed. That window is small, far smaller than most people imagine. Blood flow to the heart becomes compromised, and with every passing minute, an irreversible chain reaction begins. Heart cells, starved of oxygen, begin to die. Electrical stability collapses. The risk of fatal arrhythmias, ventricular fibrillation, ventricular tachycardia, skyrockets. And when a person is alone, that collapse often leads to cardiac arrest long before help arrives. I want you to understand something deeply. Nearly half of all heart attack deaths occur before the individual ever reaches the hospital. Not because hospitals cannot save them, modern cardiology is extraordinary. Not because treatments are lacking. But because people simply do not call for help fast enough, or because they fail to take a few simple actions that could have kept their heart beating long enough for paramedics to arrive. And the tragedy is that these steps are not complicated. They are not medical procedures. They are not advanced techniques. They are simple, life-saving habits that anyone can perform with no equipment, no training, no assistance. Yet most seniors do not know them. Or worse, they doubt themselves in the moment and lose precious time. Time is muscle. That phrase is repeated often in textbooks, conferences, and emergency rooms, but most people don't truly grasp what it means inside the human body. Imagine that your heart muscle is a city powered by electricity. Each artery is a major supply line bringing the current that keeps the lights on. When one of those supply lines becomes blocked, everything downstream plunges into darkness. Cells begin to malfunction, systems collapse, and before long, entire neighborhoods of the heart become irreversibly damaged. A heart attack is not a static event. It is a fast-moving biological catastrophe. With every minute that passes without restoring blood flow, the heart loses more function that may never return. I wish you could see what I have seen on angiograms, the stark contrast between a heart that received help within minutes and a heart that waited too long. One looks vibrant, pulsing with life, recovering quickly. The other looks quiet, barely contracting, sections permanently scarred. The difference between those two hearts is not luck. It is not genetics. It is not destiny. It is action, a swift, knowledgeable action taken in those early minutes when survival hangs in the balance. Let me ask you something, and answer honestly. If you were alone right now and felt crushing pressure in your chest, would you hesitate? Would you think, maybe it's just something I ate? Would you wait 10 minutes to see if it passes? Would you worry about calling emergency services because you don't want to bother anyone? Many seniors answer yes. They don't want to make a fuss. They don't want to seem dramatic or panicked. They convince themselves they are fine. But here's the truth, people who hesitate are the ones who die. People who act, who take the symptoms seriously, who follow the life-saving steps I am about to teach you, those are the ones who live long enough to arrive at the hospital, receive treatment, and recover. I have countless stories of people who hesitated and never made it. A 78-year-old woman who felt only mild chest discomfort but didn't want to call 911 because it was late at night. By the time her neighbor found her, her heart had suffered such extensive damage that not even emergency intervention could reverse it. A 72-year-old man who felt nauseated and sweaty but assumed it was something he ate. He walked to the bathroom, collapsed on the floor, and was found too late. A 69-year-old man who believed it was just anxiety and tried breathing exercises instead of calling for help. By the time he was brought in, his heart had lost over 40% of its pumping ability. But then there are the survivors, people who recognized the warning signs, took decisive action, and lived because of it. A 75-year-old retired carpenter who immediately dialed emergency services the moment he felt a crushing weight on his chest. He followed every step I teach my patients: aspirin, staying still, controlling his breathing, keeping his phone close, unlocking the door. By the time paramedics reached him, they were able to stabilize him and bring him straight to the cardiac catheterization lab. He walked out of the hospital with minimal heart damage and lives a full life today. The difference was not luck. It was knowledge. Your life, your heart, your brain, your independence may one day depend on what you are learning right now. I need you to internalize that. The 7 tips you will learn are evidence-based, rooted in cardiology, emergency medicine, and physiology. They are the same steps I teach my patients, my family members, and my colleagues. They are the steps that give your heart the best possible chance when blood flow is blocked and every beat matters. Before we dive into those life-saving actions, I want you to truly understand the physiology behind why acting fast matters so profoundly. A heart attack is usually caused by a sudden blockage in one of the coronary arteries, often from a blood clot forming on a ruptured plaque. When that artery closes, the clock starts immediately. Heart muscle begins dying within 10 minutes. Within 20 to 30 minutes, the damage becomes irreversible. Within an hour, entire sections of the heart may no longer function. Past 3 hours, the likelihood of surviving without severe disability or heart failure drops dramatically. This is why the majority of heart attack deaths occur within the first hour. And for people who are alone, especially seniors, that hour passes in silence. You deserve better than silence. You deserve knowledge, preparation, and the confidence that if this moment ever comes, you will not be helpless. By the time you finish all 6 blocks, you will understand not only what to do but why each step works, what it does to your blood flow, your oxygen levels, your coronary vessels, and your heart's electrical system. You will be prepared in a way most people never are. Now, take a breath, stay with me, and let me guide you step by step through what could one day save your life. When the first signs of a heart attack appear, your chances of survival are determined in the very first minutes, not in the hospital, not in the ambulance, not in the operating room, but in the exact moment you decide whether to reach for the phone or to wait and hope the feeling passes. This single decision, this single moment of action or hesitation, separates the people who live from the people whose lives end silently at home. I need you to truly feel the weight of that reality. The most powerful life-saving intervention available to you is not a medication, not a defibrillator, not an advanced medical procedure. It's the decision to call emergency services immediately. Let me explain why this matters on a physiological level, in a way most people have never heard. When a coronary artery becomes blocked, the heart muscle downstream begins to suffocate. Within seconds, electrical instability begins. Within minutes, the risk of ventricular fibrillation, the deadliest rhythm on Earth, skyrockets. This rhythm does not wait. It does not give you time to monitor your symptoms. It can strike suddenly, turning a conscious person into someone unconscious with no pulse in an instant. And once circulation stops, the brain has only a few minutes before permanent damage begins. That is why waiting is the most dangerous thing you can do. Every second you delay calling emergency services allows the storm inside your chest to intensify. Yet, despite this knowledge, most seniors still hesitate. They doubt themselves. They fear overreacting. They think, I don't want to bother the paramedics, or maybe it's just indigestion, or let me sit down and see if this goes away. I have seen the consequences of every one of those thoughts. I have stood before families who lost someone they loved because that person waited 20 minutes before calling for help. I have reviewed the EKGs of patients who suffered massive, irreversible damage during the moments they spent trying to convince themselves it wasn't serious. Time is muscle, yes, but time is also life, independence, memory, mobility. When you lose heart function, everything in your life changes: your energy, your breathing, your ability to walk, your capacity to live with freedom. A heart attack doesn't just kill, it can imprison you in a body that can no longer do what it once could. This is why calling immediately is not just about surviving, it's about preserving quality of life. Now let me share something that very few people understand. Calling emergency services triggers a chain reaction of medical interventions that begin even before the ambulance arrives. Dispatchers can alert paramedics with a code STEMI, which means they come prepared with medications, oxygen, cardiac monitors, and advanced life support equipment. The moment they reach you, they can diagnose the heart attack on the spot with a portable EKG, start 4 lines, administer medications to stabilize your heart, restore rhythm if necessary, and begin oxygenation. Studies show that patients who activate emergency services early reach the catheterization lab, the place where life-saving artery opening procedures occur, far faster than those who attempt to drive themselves or wait for someone else to take them. In fact, patients who call emergency services receive treatment up to 30 minutes faster than those who arrive by private vehicle. That is not a small difference. That is the difference between life and death, between a heart that survives and a heart that never recovers. Now imagine the opposite scenario. Imagine you hesitate. Imagine you walk around your home trying to decide if it's serious. Imagine you lie down, thinking rest might help. Imagine you wait 15 minutes, hoping it stops. Inside your chest, the blockage is growing. The clot is stabilizing. Oxygen levels are dropping. Electrical instability is increasing. The window for survival is shrinking. And by the time you finally decide to call for help, your heart may already be in the middle of a deadly arrhythmia that collapses you before you dial the number. Or you may lose consciousness before paramedics arrive, locking your door and leaving them unable to reach you. Or you may survive the attack but lose half your heart's pumping ability. All of this begins with hesitation. I want to show you how real this is through a story I will never forget. A 68-year-old grandfather named Alan felt a strange heaviness across his chest one evening. He walked to the kitchen. He sat down. He drank water. He told himself it was probably something he ate. 25 minutes passed. When he finally decided to call emergency services, he collapsed before he could finish dialing. By the time his daughter found him, the damage was irreversible. When she looked at me in the ER and asked, could he have survived? I had to answer honestly, yes. If he had called within the first 5 minutes, he likely would have lived. That truth stays with you forever. And then there is the opposite story, the kind that proves the power of immediate action. A 74-year-old woman named Teresa felt sudden pressure across her chest while folding laundry. She had watched one of my lectures years earlier. She remembered my words: if you feel chest pressure, call immediately. Do not evaluate. Do not negotiate. Do not wait. She dialed emergency services within 30 seconds. Paramedics arrived in 7 minutes, performed an EKG, identified a complete blockage of her left anterior descending artery, and transported her directly to the catheterization lab. Within 35 minutes of her first symptom, her artery was open. She survived with almost no heart damage. When she visited me months later, she was walking 3 miles a day with full independence. The difference between Teresa and Alan was not luck. It was action. Let me break down the science that explains why this immediate call is so crucial. The heart muscle relies on a delicate supply of oxygen-rich blood to function. During a heart attack, the artery supplying part of the heart becomes obstructed by a clot. Without blood, the cells in that region begin to die. But the death is not instantaneous. It occurs gradually, wave after wave, hour after hour, unless blood flow is restored. The earlier you receive help, the more heart muscle can be saved. The American Heart Association reports that early emergency activation can improve survival by up to 50%. That is extraordinary. That means half of the people who would have died are saved simply because they made that call early. Now I want you to imagine a version of yourself in the future, 5 years from now, 10 years from now, standing in your home when a sudden tightness grips your chest. Imagine feeling a wave of dizziness wash over you. Imagine your breathing becoming shallow, your skin turning cold. In that moment, will you be the person who hesitates? Or will you be the person who acts? Will you be the person who debates whether it's indigestion? Or will you be the person who picks up the phone and takes control of your chances of survival? Your answer to that question may one day save your life. Calling emergency services is not overreacting. It is not panicking. It is strategy. It is protection. It is choosing to live. It is choosing to give your heart the oxygen it needs before it is too late. And here is something I want you to tattoo into your memory. If you are over 60, any chest pressure, unexplained shortness of breath, sudden nausea, or cold sweat must be treated as a potential heart attack until proven otherwise. You lose nothing by calling. But you risk everything by waiting. So when the moment comes, and one day it may, you must act immediately. Dial emergency services. Put the phone on speaker. Stay on the line. Let the dispatcher guide you. You are not alone. You have help on the way. And by making that call, you will have just taken the single most life-saving step available outside of a hospital. The moment you finish calling emergency services, the next decision you make can dramatically influence the outcome of your heart attack. And in this fragile window, those terrifying, precious minutes when your heart is fighting for its life, one of the simplest and most powerful actions you can take is to chew an aspirin. Not swallow. Chew. This distinction matters more than you can imagine, and I need you to understand exactly why. Aspirin is not just a common household medication. It is one of the most studied, proven, life-saving drugs in cardiovascular medicine. Hospitals use it. Emergency physicians depend on it. Cardiologists recommend it. And for someone alone during a heart attack, aspirin becomes an emergency tool capable of slowing the catastrophe unfolding inside your chest. Yet millions of people either do not have aspirin at home or do not know the correct way to use it in a cardiac emergency. My mission is to ensure you are not one of them. Let me take you inside the physiology of what happens during a heart attack, so you understand exactly why aspirin matters. A heart attack almost always begins with a rupture inside a coronary artery, an unstable area of plaque that breaks open. Once this rupture occurs, platelets swarm to the site like emergency responders, trying to plug the break. But instead of forming a tiny patch, they form a growing, dangerous clot. This clot expands like wet cement thickening in a pipe, blocking the flow of blood to the heart muscle. Every pump becomes weaker. Every second becomes more dangerous. Now here is where aspirin enters this story. Aspirin interferes with the very mechanism platelets use to clump together. It blocks a critical enzyme called COX-1 and stops platelets from forming a larger, deadlier clot. It does not dissolve the clot entirely, that requires medical treatment, but it keeps the clot from growing, and that can mean the difference between partial blood flow and complete blockage. It can also prevent a full artery closure from becoming fatal. But not all aspirin is equal in an emergency. If you swallow a coated aspirin tablet whole, your stomach must break down the coating, release the medication, and absorb it into the bloodstream. That can take 10 minutes, sometimes 15. During a heart attack, 15 minutes is a lifetime. The clock is not a clock, it is your heart dying cell by cell. Chewing the aspirin allows it to absorb rapidly through the mucosal lining of the mouth and stomach, entering the bloodstream in a fraction of the time. The faster it gets into your system, the faster it stops that clot from getting bigger. I remember a case years ago that still echoes in my mind. A 70-year-old man named Don was sitting at his kitchen table when he felt a crushing, burning heaviness grip his chest. His wife had passed away, his children lived far away, and he was completely alone. He told me later that instinctively he reached for the aspirin bottle he kept in a drawer, something his doctor had told him to do years earlier but he had never really taken seriously. He grabbed one tablet, chewed it aggressively while calling emergency services, and waited. When he arrived at the hospital, his EKG showed a full arterial blockage, but the damage was far less severe than expected. The cardiology team that treated him said the same thing I did the next morning, that aspirin bought you time. It saved a portion of your heart muscle. It saved your life. Contrast this with another patient, a woman named Elaine, who suffered a similar heart attack but did not chew aspirin because she did not know she should. She hesitated, unsure whether it was safe. She swallowed one after several minutes, but by then the clot had grown so large that her heart sustained massive damage. She survived, but she never regained her full heart function. She cannot climb stairs. She cannot walk long distances. She cannot live the life she once had. I share her story with permission because she wanted others to learn the lesson she learned too late. Hesitation costs more than people realize. That single pill, when used correctly, reduces the risk of death by 23%, according to large-scale studies. But again, speed is everything. Chewing accelerates absorption. Chewing initiates platelet inhibition faster. Chewing gives your heart more oxygen during those critical minutes. And chewing is what cardiologists teach their own families, their own parents, their own elderly patients. And yet many seniors do not keep aspirin anywhere accessible. Some keep it in a cabinet behind other bottles. Some keep it upstairs. Some keep it buried in a drawer. I tell every patient over 60 the same thing: keep aspirin in a place you can reach without effort. A kitchen drawer. A bedside table. A purse. Your living room. Anywhere you spend time. Because when the moment comes, you might not be able to climb stairs. You might not be able to walk across the room. You might not be able to lift your arm higher than your shoulder. Heart attacks weaken the body quickly. You must make aspirin easy to grab. But let me clarify something critical: aspirin is not for everyone. If you have a known aspirin allergy, a history of severe stomach ulcers, a bleeding disorder, or if your doctor specifically advised you not to take aspirin, then you must skip this step. Safety always comes first. For everyone else, keeping non-coated, plain aspirin at home is a wise and potentially life-saving precaution. I want you to also understand that aspirin is not a cure. It is a bridge, a temporary shield that slows the damage until professionals can reopen the artery. But that bridge can be the difference between reaching the hospital alive or not reaching it at all. It can be the difference between your heart recovering or failing. It can be the reason you survive long enough to see your family again. Imagine yourself alone one afternoon, sitting in your living room, when a wave of chest tightness hits you. Imagine your breath becoming shallow, your skin growing clammy, that instinctive fear rising inside you. Now imagine two paths. In the first, you ignore it. You wait. You hope it passes. You lose precious time. And the outcome is bleak. In the second path, you act immediately. You call emergency services. You chew an aspirin. Within minutes, the clot stops expanding. Your heart receives partial flow. You buy yourself enough time to survive. The paramedics arrive, stabilize you, rush you to the hospital, and you live to tell the story. That second path is the one I want for you. But it only becomes possible if you prepare, now, today, before the emergency. Preparation is empowerment. And empowerment saves lives. So here is what I urge you to do the moment you finish reading this: find a bottle of plain aspirin. Place it somewhere easily accessible. Tell your spouse. Tell your children. Tell anyone who might be with you at home. And repeat this phrase to yourself until it becomes instinct. Chest pressure? Call emergency services. Chew aspirin. This simple pairing of actions, one phone call and one chewed tablet, forms the frontline defense against the most deadly emergency adults over 60 face. Do not underestimate it. Do not delay it. Do not question it. When the moment comes, act. Now that you've called emergency services and chewed an aspirin, your next steps are not about medication, they're about physics, physiology, and survival. These steps are deceptively simple, so simple that many people dismiss them as unimportant. But in the middle of a heart attack, when your heart is struggling to push blood through a blocked artery, every detail matters. And this particular action, loosening tight clothing and positioning yourself correctly, can drastically reduce the workload on your already distressed heart. As a cardiac surgeon and emergency physician, I cannot count the number of times I have watched a heart attack spiral downward, not because the patient lacked medication, but because their body was in the worst possible position for survival. Tight belts, constricting collars, abdominal pressure, slumped posture, these seemingly harmless details can trap your lungs, compress your vessels, and demand more oxygen at the very moment when your heart cannot supply it. Let me explain exactly what happens inside your chest during a heart attack so you can understand why your position and your clothing matter so much. When an artery feeding the heart becomes blocked, even partially, the heart muscle downstream is starved of oxygen. Every contraction becomes weaker and less efficient. Your lungs must work harder to bring oxygen into the body, but your heart struggles to deliver it where it is needed. This is called a supply-demand mismatch. Your organs are demanding more oxygen than your failing heart can deliver. Now imagine adding external pressure to that already unstable system: tight fabric around your waist, a constricting bra, a tight collar, a belt pulling your abdomen inward. That compression reduces lung expansion, restricts diaphragmatic movement, and limits the space your heart has to beat freely. This forces your heart to work harder for every breath and every contraction. For a healthy person, this might be a trivial inconvenience. For someone in the midst of a heart attack, it can push the heart into collapse. This is why loosening tight clothing is not a cosmetic adjustment, it is a life-saving maneuver. When you release pressure around the waist and chest, your lungs can expand more fully, your diaphragm can descend naturally, and your heart gains space to pump with less resistance. Think of it as removing heavy sandbags from a sinking boat. The lighter the load, the more time you buy before complete failure. But your posture matters just as much. In a moment of fear, many people instinctively lie down, believing rest will help. Lying flat can be dangerous. Let me tell you why. Your lungs sit above your heart. When you lie flat during a heart attack, your lungs expand less effectively, especially if fluid is already accumulating in lung tissue, as often happens during cardiac distress. This reduces oxygenation at the exact moment when your heart is desperately fighting for oxygen. Additionally, blood returning to your heart increases when you lie flat, creating more pressure, more volume, more strain. It's like asking a struggling engine to suddenly operate at full capacity. By contrast, sitting upright allows gravity to assist your lungs. It frees your chest cavity, reduces pressure, and improves airflow. Your diaphragm has more room to move downward, a critical action that helps draw oxygen deep into the lungs. Your heart has less venous return to fight against. The strain decreases. The oxygen supply increases. Your chances of staying conscious rise significantly. I want you to imagine something, a scenario I've seen far too often. A 74-year-old man feels crushing chest pressure while watching television. He lies down on the sofa, thinking rest will help. His diaphragm becomes compressed, his lungs flatten, his breathing becomes shallow. Within minutes, dizziness overtakes him. His heart cannot keep up. He loses consciousness. When paramedics arrive, they find him unresponsive, his airway partially restricted by the position of his neck. What was meant to bring relief instead accelerated the collapse. Now contrast that with a woman named Rosa, age 76. She felt a tightening in her chest while baking in her kitchen. Her hands trembled. She felt faint. But she remembered something her daughter, one of my former patients, had told her: sit upright and loosen everything. Rosa turned off the oven, sat in a sturdy chair, unfastened her bra, loosened her waistband, and leaned slightly forward with her arms resting on the table. This position, known clinically as tripod positioning, expanded her chest, eased her breathing, and reduced the workload on her heart. She called emergency services and remained conscious until help arrived. Her cardiologist later told her that those simple adjustments likely prevented a respiratory collapse. These little stories matter because they reveal one truth: survival is often about what you do in the seconds and minutes before help arrives. Let's go deeper into the physiology. When you sit upright, gravity pulls fluid downward, freeing the lungs to expand more fully. If fluid begins to pool in the lungs, a side effect of decreased pumping efficiency, upright positioning prevents that fluid from drowning the tiny air sacs called alveoli. By staying upright, you maintain a larger oxygen reserve. And oxygen is life during a heart attack. Additionally, sitting upright lowers intracardiac pressures. This means your heart doesn't need to squeeze as hard to push blood out. The weaker the heart becomes during a heart attack, the more this matters. A weaker heart cannot fight gravity effectively when lying down, but sitting upright relieves it. Another benefit: maintaining consciousness. Loss of consciousness during a heart attack is often due to reduced blood flow to the brain. Sitting upright helps maintain cerebral perfusion, meaning more blood reaches your brain. This keeps you awake, aware, and able to respond when paramedics arrive. Being conscious dramatically increases survival because it allows emergency personnel to treat you quickly rather than spend precious seconds or minutes trying to resuscitate you. And there is another subtle but powerful reason posture matters: panic control. When people lie down, they often feel more helpless, more trapped. Fear tightens the chest further, increases breathing rate, spikes adrenaline, and raises heart stress. Sitting upright gives your body a sense of readiness. It engages your brain in a survival mode that is calm, focused, and decisive. That mental shift alone can slow your heart rate, preserve oxygen, and prevent irrational movements that worsen the attack. But this only works if you prepare now. You must know where you would sit in an emergency. You must know which clothing items you could loosen quickly. You must understand that this is not a suggestion, it is a vital part of your survival plan. If you live alone, choose a chair near the entrance. Not too soft. Not too low. Something stable with a backrest. Not a recliner, those tilt you backward and compromise breathing. A dining chair is ideal. Keep the area around it uncluttered so you can reach it even if dizzy. If you wear tight belts, compression garments, tight bras, or clothing that requires both hands to remove, practice loosening them quickly. Heart attacks often weaken grip strength. You must be able to loosen clothing even with trembling hands. If you wear jewelry that constricts the neck, remove it. Every second of unrestricted breathing counts. Do not underestimate this step. Your body position can literally determine whether oxygen reaches your heart and brain long enough for paramedics to save you. Remember this phrase: sit up, loosen, breathe. It is the sequence that protects your airway, your lungs, and your failing heart during the most dangerous moments of your life. Combined with calling emergency services and chewing aspirin, this step creates a powerful triad of immediate survival. But there is still more. You must also ensure that blood continues circulating to your brain, even if your heart rhythm becomes unstable. And that leads us to the next technique, one so unusual yet so effective that it has saved countless lives when used at the right moment.